Okay. So this young girl here is, how old is she? 2 years old, and she's here for a direct admission to the hospital for possible Kawasaki disease. And so we're going to actually, Mom has agreed to let us just do a real fast video here, just to kind of try and capture the essence of the disease. How long has she been sick?
About 6 days.
6 days? Okay. Now she has had some positive strep cultures, you said, but she's just not eating, and you've noticed that her mouth is, she's got cracked and bleeding lips, is that right?
Yes.
And she's had a fever how many days now?
6.5 days.
6.5 days. And then you've also noted on her hands, is it just on her hands then?
It's on her hands and her feet.
Okay. I'm going to actually ask, would you guys move her out into the light a little bit so we can... yeah, this is good. This is good. Okay. Hi, sweetie. And I'm just going to I'm going to try and capture her lips a little bit here. And then let's turn her hands over. And okay. Now let's see the other hand. Okay. And then as far as any like swollen lymph nodes on her at all?
Not really swollen lymph nodes. The rash also goes.
Let's see this rash.
And from her neck all the way down to her growing area and across her stomach. The rash, like her hands, is also on her feet.
Yeah. Okay, so it's kind of a fine...
the back is worse than the stomach.
papular type rashes. It's not really elevated. Okay, let me see our other foot too. Hey, sweetie. All right, and let's take a look at her back then. Really appreciate you letting us. Okay, all right. It's definitely not like a strep throat rash. Now let me just palpate. Let me just palpate for lymph nodes on her too. She has some shoddy little lymph nodes, I think. Shoddy means basically it's a term which I'm going to try and come around with my other hand to the front here.
She's also had the swollen eyes.
Yeah, that's right. That's right. She's got some, I think, little lymph nodes, but they're not real dominant. But so what's going on with her eyes?
Running pus and swelling shut.
Okay.
Every once in a while.
Okay. Let me just pull the eyelid down just a little bit. Kind of reddish looking in there. You see some dried stuff around there. Okay. All right. Now let's see if I can just get a look at her mouth real fast. Yeah, just want to pull your lips down. Maybe Mom could do that. Could just kind of open her mouth just a little bit so we can see what some of the lips.
They're just so dry and hurt, and I don't want to.
Yeah. No, I agree. Looking up underneath there, I see the corners cracked a little bit over there. Okay, you were a trooper. Thank you guys for being patient here, and thank you, ma'am. I'm going to ask if you just sign a permit to let me use this on YouTube for training.